Yes, sir. Please go ahead.
Indeed, it is a great honor to introduce the excellent clinician and renowned academician, Dr. Sanjay Tewari, sir, my good friend, who is kind enough to give the time to this noble cause of the topic, which is chosen by Dr. Mahalakshmi Madam and team for training the trainees. SRM Ramapuram, we really congratulate you for this outstanding effort. And as we all know, whenever I see the serious academicians involved in this kind of a program, I still remember our past Vice President of India, Sarvepalli Radhakrishna, who is this second Vice President and first Vice President and second President of this nation. He always used to say, the true teachers are those who help us think ourselves. Yes, this entire concept of this program, I feel that it revolves around that. And if I am right, I am sure many of the teachers, whoever are involved in this program, are really enriched with knowledge and upgrading their skills and talents. And thank you very much once again for giving me the opportunity, the outset. Here to you, Dr. Sanjay, sir.
Very good afternoon to all of you. Am I audible?
Yes, sir.
Yes, sir.
Just a minute. I should share my screen. Huh?
Yes. Is it coming?
Yeah, it's okay. It's okay.
Yeah. Yes, sir. Yes, sir.
Very good afternoon to all of you. I hope I have seen the presentation of Dr. Majumdar, Dr. Pamita, the meticulous presentation, and they have worked so hard for this thing. But what I am going to speak today about this Viva tricks and hacks, this will be my personal experience, what we have been following in the last 30 years. And before I start my presentation, I thank Dr. Karunakar sir for chairing this session. He is a very good friend, very good, very meticulous person, and he has been chairing my previous session also. And I thank Dr. Mahalakshmi Madam for inviting me to do my presentation on this forum, faculty development program. It's actually a very good noble cause, I can say, because we all must know how to perform, how to work if you want to improve your specialty. And every phase is a learning phase, like pedagogy or pedagogy. We learn from every time when we listen, we learn. So it should be a learning experience, and we must not feel every time ashamed that I may not be knowing, I may be knowing everything. I being a big boss, I'm a senior person, I have to learn from everyone. Then that's why our specialty can progress. And I'm a great admirer of Dr. Mahalakshmi Madam. I met her in 2007. I saw her meticulousness in her conference, which she organized in Malaysia in 2007. Then we saw her working in the Root Summit in 2014. Then her involvement in the World Endodontic Congress as a scientific chairperson. All these things. So I always admire her commitment and excellence, and that's why I cannot stop and doing any presentation if she calls. So we make it sure that when she's doing something, we have to be there. This is basically a presentation what I've been told for the trainers. So how do we perform? How do we work? I may be wrong some way, but I just tell you what we have been doing it and how, in case you have some suggestion, you can add us. So before I start my presentation, I bow my head to this stalwarts of teachers of our specialty who have taught me to conduct the examination so these are my mentor, Professor C.P. Govla sir, Dr. Jagdish sir of the Government Dental College, Bangalore. Later he shifted to RB Dental College. I'm very lucky enough that I could conduct the examination with these teachers like Dr. Jagdish, Dr. Manjunath sir of JSS, Dr. Naseem Shah madam of the AIMS. So we learned from them. We saw them how they work. We grew, and then today I could see my students like Dr. Vinita Nikhil is there. I saw her. See, they all are growing. You all are growing. We have already passed our time. So we have to learn from each other how to perform and how to improve it if you want to improve our profession. So whenever we go for conducting a practical examination, I always tell everyone that we have to make preparations for conducting the examination and via Voce. We may not be knowing everything. What my knowledge was there 20 years back, that may not be knowledge today. So I have to update my knowledge because I am examining a 3-year performance of an MDS student in 2 days. It is actually a very big responsibility. I think all of us remember our MDS exams, and most of us even remember the question being asked. I also remember the question what was being asked for my exam. So we all do. It's a very important event in anybody's life. So always remember that it's an honor as well as responsibility to conduct a practical examination. So what I do, we have to revise that. I request all the new examiners who are becoming new examiners that please revise the recent edition of the standard textbooks. There is no harm, no shame. I revise it. I see, because what edition was written in the latest edition may not be in previous edition. So our student, we are examining a student. We are not examining showing what we are knowing it. So what he has read it, we have to ask from them. Secondly, very important thing is also please go through the recent articles, systemic reviews, and meta-analysis to update your knowledge about the subject. Here is again very important because our specialty is growing, things are changing. We have been past 20 years back, 30 years back. They may not be knowing it. So there is no harm. We should know it. And rather, I make notes for examination. I always make notes because that knowledge, we have to, what we are knowing it, we have to see that whether my knowledge is updated or not. So another important thing, besides these two things, that you have to revise your recent editions, you have to revise, go through the recent articles, and of course, it's up to you, but I personally, I even make the notes. I do preparation for examination. Whenever you make me examiner, I don't accept it, but when I make notes for that also. And also very important thing, many times our examiners ask the questions where he is not sure whether his answer is correct or not. So we have to verify that what question we are asking, whether and what answer we are knowing, whether it's correct or not. And please ask the questions from the recent edition of the standard textbooks and recent journals of the journals for the objective assessment of the student knowledge. You know what happens when you do a CBC, when somebody appears in CBSC, and when you go for evaluation, how they assess the question? They give an answer to the question. When somebody assessing the copy of the CBSC 10 or 10 plus 2, they give you a question, they give you an answer. Then you check the question, student answer according to that what answer they have given it, and then they give the marks. So there, what I mean is that there has to be objectivity, clear objectivity in the assessment of the student performance, student knowledge. And I am good in statistics. I love statistics. It's my favorite subject. So whenever I talk something, I always bring statistics over there. So please be very careful and very sure when you are doing the examination that during assessment of the examination, when you are assessing his performance, we have to be very, very sure that our performance assessment is correct, especially when we are failing the student. Always remember the type 1 error or alpha error is only 5%, and type 2 error is 20%. What is type 1 error? That is failing a student who is deserving to be passed. And when you are failing some student, you have to be 95% sure that there are chances of the error of the commitment of error of only 5%. 95% you have to be 100%, you have to be sure. While for the type 2 error, that is the passing the non-deserving student, is 80%, is 20% only. So you have to, power of the study has to be 80%. So you have to be 80% sure that you are passing, whom you are passing, you are correctly passing the student. Here you have got leeway of 20%. You can pass somebody who may not be that deserving, but for failing the student who is deserving, you have an error of only 5%. So all these errors, both type 1 errors and type 2 errors, can be reduced if sample size is increased. This is a simple formula of a statistics. So how do we remove this type 1 error for reduction of the type 1 error and type 2 error? The only method is to increase the sample size. What is sample size? Sample size means in this when you are asking the Viva is the number of questions, the variety of questions from each candidate from wide range of topics, not a one topic, wide range of topics, and covering almost complete course. Please remember that you are assessing a performance of a student who has worked for 3 years in 2 days. So there has to be wide variety of the questions from each candidate. So for that reason, I always say, please make preparations for the same. You revise your knowledge, you revise what articles have recently published, and then you make preparations for conducting the examination. Now, about the Viva, Madam has given many topics, many things, what I have to speak, but I am just telling you that Viva, basically, we divide the Viva into what we conduct the examination, either grand Viva, chair side Viva, thesis Viva, case discussion, and pedagogy Viva. Out of this, we have to give adequate time to each student for all these Vivas. Because many times we give a long time for the grand Viva, but at the end of the day, grand Viva, your student is exhausted. So for every Viva, you have to give adequate time. And out of this, what I personally feel, but my experience, or may not be, Dr. Karnakar sir is here, they will be further adding it. But I personally feel that chair-side Viva is one of the very important steps, because that time the student is fresh, that allow you to assess the practical knowledge of the student as well as the clinical knowledge and you can ask variety of questions during the chair-side Viva. And that is a forum that you can assess a wide broad range of topics from the student. Of course, there has to be good discussion on the thesis Viva. And then again, another important Viva is about his performance of 3 years, that is case discussions. We always ask that, suppose he is presenting 20, 30 cases, good cases, that Viva should be a prolonged Viva, because that tells you, because you may not be remembering everything what you are asking it, but when he presents something, you come to know that this wide range of topic are there, and there you can extend his Viva so that you know what he has performed in last 3 years and what is his actual knowledge is. And of course, the pedagogy. So when we perform the grand Viva, we have to assess the candidate knowledge about the complete subject. We have to assess the knowledge of the student about the basic knowledge to the advanced knowledge of the subject. We have to try to cover each and every point, the knowledge about the recent advancements, the clinical implication of the basic sciences of topic related to the specialty, the reasoning in diagnosis and treatment planning, and selection of material and techniques. So the grand Viva has to be covering the almost every part of the subject. So divide the time for each subject, each topic, important topics, and how much time you're going to give for grand Viva, and try to cover everything, because a student may not be good in one topic, maybe good in other topics. So we have to try to give him enough time we have to prolong it. I conduct the grand Viva for about 1 hour to 1.5 hours, so that we assess what all he has performed, whether he's knowing something subject, or his knowledge is superficial knowledge, or he has got deep knowledge, or he has got in what part he is good or he is bad. And when you are conducting a Viva, there has to be an objectivity of the assessment. Sometimes we may like somebody may not like somebody. So we may ask different level is different. But we propose, please tell our new examiners that there has to be objectivity of assessment. Please ask the variety of questions from each candidate from each or similar topics. Secondly, there has to be a similar level of difficulty from each candidate. starting from simple questions, start your grand Viva, starting from the simple questions and then going for difficult ones. Start from the basic knowledge to the advanced knowledge, then the recent advancement in the specialty, and divide the time topic-wise for assessment. And one student may not be knowing one topic, but maybe very well good in other topics. So try to explore that. And by conducting the Viva, please make the student comfortable. Try to reduce the anxiety. See, we all are anxious. When I am presenting, I am anxious. Everybody is anxious when you are appearing examinations. So our aim is we have to extract his knowledge, what he has done in the 3 years. So we have to make him comfortable. We have to reduce his anxiety, and we have to encourage and sometimes appreciate him during the exam so that we can bring maximum out of him. Encourage him to answer and give him clues also. Many times we ask questions, we have to give him clues also. Encourage a student to tell about his knowledge rather than to show him what you know. It is, if he is not comfortable or sound in English, ask him to even speak in the local language only. No worries. Ultimately, it is important for us to assess his knowledge and practical skills. So this has to be encouraged. And then comes the how do we assess the thesis evaluation. I'm going to cover every topic. How do we evaluate him for thesis evaluation for every exercise separately. But almost all these things have, whatever under what heading we have already discussed, we will be covering that way. When we are conducting a Viva for thesis evaluation, to ask a student to present the thesis within 8 minutes, emphasizing in short on the brief introduction of the and rationale of conducting the study, the research questions in the PICO form, that is, what is population, what is intervention, what is control, what is outcome, what is about aims and objectives, methodology, results in tabulated form, and discussion. You ask after his presentation, please ask the questions related to his knowledge about the topic and gap in knowledge. Whether he's clear about methodology and primary and secondary outcome of the study. And lastly, about his knowledge about the statistical analysis, how we collect the sample size, what is the method of collection of sample size, does he know how the sample size is calculated, what is about knowledge about the research methodology, particularly in blinding, randomization, method of blinding, the rationale of selecting the statistical test, that he should be knowing it. So we have to ask this question. See, he may not be knowing the questions what you are asking him, but once you ask these specific questions, which will be helping him to go further, even the message conveys to the juniors, message conveyed to other faculty. So ultimately, by asking specific questions, good questions, you are improving the standard of the department. You are improving the standard of that particular college where you are asking the question, and even you are updating your knowledge also. So then comes the CSI Viva. I always say CSI time Viva. Those who have seen me taking examination, we always should conduct a long CSI Viva, because that is when candidate is fresh. So please, here we have got two things. We have to assess that patient's clinical skill, the student's clinical skill also, and about his knowledge, practical knowledge when he is performing the particular exercises. So please ask the relevant questions regarding the each exercise, about the case selection, how diagnosis was made, what are the alternate treatment options, what instruments have been used, and how they have been used. Even, see, we have to know, he has to know how to use the instruments, what speed he has used it, what precaution he has to take by using those instruments, what materials he has, what material he's using, is he aware of the property of the material or not? How is he aware of the guidelines being issued by the manufacturer, how to use the materials? Many times students miss the thing. So how instruments were used, about his clinical applications, the practical utility of subject knowledge, and concept-based questions. So these had a broad range of doing the CSI Viva. So then comes the CSI Viva for end exercise. What I go for, we go ask the Viva about the diagnosis, how he has made a diagnosis, how he has made a treatment planning, what are the alternate treatment options, and take the Viva about each and every procedure being performed, and especially knowing whether the student is following the laid down protocols, because many times we don't know the we don't follow the lay-down protocols. So what lay-down procedures, starting with what is knowledge about the LA, what percentage of LA is being given, what complications are being given, what dose of LA is being given, how do we manage the complications of LA, how do we manage the medical emergencies, that he has to be clear, because they are all doctors. He has to be given throughout the life, so he should be very thorough. Then about the history of the systemic disease, because if he is coming across, whether he's taken care or not. Then about the exopening, of course, we ask them the exopening concept, the recent concept of exopening, the working and determination, whether he knows he know how to use the apex logators, what lay-down procedures are being used, he has to know it. Then our instrumentation techniques, then irrigation protocols, all these things, the irrigation being used. You see, many times students don't know what is the size of irrigation needle. He is using an irrigation needle which doesn't go up to the apex. So he has to be told. He has to be asked this question. If he has not used, no worry. But he has to know that this thing, he has to use it. Then method of activation of irrigant. Then the obturating techniques. And one important thing during endo exercises is about the radiation hygiene. What I have seen, many times when students conduct the examination, they all hold the X-ray film in their own hand, and they take the X-rays. They don't follow the radiation hygiene. We have to tell them, emphasize upon them there are stochastic effect, there are deterministic effect. So the stochastic effect, even one radiation can be harmful. So if you emphasize upon them that this, you have to hold use the X-ray holders, and then you have to take the X-ray. They have to be told what you do in your MDS only, that you follow it. What you do in an exam, that you follow throughout life. So these things have to be emphasized when student examination is conducted. And please ask them good number of questions about the radiation hygiene. Are they following the ALARA concept or not? And lastly, I told you that about the knowledge about the medical and dental emergencies. Now comes the chair-side restorative techniques. When we go for Viva for restorative techniques, please ask the question related to the diagnosis, the treatment planning of the cases, the alternate treatment options. If he is making inlay, he has no. He is making inlay. He has no other treatment options. How do other techniques are available? How composite rapings perform well? Whether what technique he has used is justified or not. Then how should he manage the pain and anxiety? How he give the LAs? How he does the isolation of the area? What instrumentation he has been used during cavity preparation? Is he aware of this thing? And whether what cavity design he is following it? Is he clear about the cavity design concept or not? What materials he's using? Is he clear about the basic property of the materials and knowledge about the clinical applications? And about the finishing process and polishing process. So all these questions, Viva, have to be asked from each and every question student, so that we assess whether he has got the basic knowledge or not. Then for the GSI Viva for the endodontic restorations. For post-endodontic restorations, again, basic knowledge about post-endodontic restorations. The case selection, treatment planning, we always ask. Then what are the alternate treatment options? If he's making the cast restoration, does he know what about the prefabricated post, their basic properties, in what condition they are being used? And of course, when he's doing the post phase, how should be the size of preparation, what length preparation he has to go, what instruments he has to use, what is the property of the waxes, what is the property of impression materials, how does he manipulate the wax, how we make the dyes, how does do the casting, or then his knowledge about the casting defects, prevention of casting defects, how he has gone to the gingival retraction, then knowledge about the impression material and techniques. Because impression material technique, many times you see, we know it for impression materials, there has to be adequate thickness of impression material to take the accurate impression. Does he know or not? Does he know how easy he has to early and what time gap should be there before pouring the impression? How does he do the installation of the decontamination of your impression, the impression? So all these things have to be checked and asked him, and we can only know it when we make the points. If you just forget point, we may not believe it. These things have to be specifically asked from a student when he's performing a particular exercise. Then comes what he should not do, what we should not do, and what should we do during conduct of the examination. First is, we should please devote full time in conducting the exam. Many times the examiners are with not humbleness and one should not feel bad for this thing, but I must say many times examiners are in hurry, either to leave early or to go for other commitments such as shopping, interested in sightseeing, meeting friends, visiting temples, etc., etc., etc. Please avoid these. If you are busy, please say that you don't have time, or say, but if you say yes, then please give full time for exams. Always remember that you are assessing 3-year performance of a student in 2 days. You are assessing the 3-year performance, as I already told you in the starting of my lecture, that we all remember our exam. We all remember the even questions being asked. It's a very, very important life event of anybody's life. So, and plus we have been honored and we have been responsibility to conduct the examination. We have to come with a type 1 error of only 5%. We have got chance of the liberty of committing type 1 error of only 5% and type 2 of only 20%. So please give full time to the examination. Please, and rather enjoy the conducting the examination. Please avoid the unnecessary talks between the Viva or during the assessment of the practical exercises. It demoralizes students as well as divert your attention. Please don't pass the sarcastic comments on students. Don't harass the students or shout on them during the exam. Don't discourage the student. Be impartial. Always go for null hypothesis, that there is no difference, all are good. And especially if he is not liked by the internal exam. If you get a clue that he is not liked by anyone in the environment, please then be more sure that you have to assess him properly. Give him good work, congenial atmosphere. In that case, it is many. So with these things, I finish my lecture and I dedicate my presentation to one of the most respected teachers of our specialty, Professor Jagdish sir, the former professor head of the Conservative Dentistry and Endodontics, GDC Bangalore and RB Dental College Bangalore. I'm very lucky that I could get, I told you, the opportunity to work, to conduct the examination with star-ward like Dr. Jagdish sir, Dr. Manjunath sir, Dr. Naseem Shah madam. So with these things, we have, and Dr. Jagdish is a very humble person. He conducted an examination in 1987. And he took the Viva of each and every student for 1 hour to 1.5 hours. And we were so happy that time that somebody is testing our knowledge. Rather asking any question, what he is knowing it, he is asking the question from the course. We got very happy and we decided that that time, no, we will become examiner. When I conduct my examination, I will behave like that. What has wrong has been happened to me during my examination, I should not do that thing, but I should do what looks good, how it becomes, how the student conduct examination is been liked by other thing. So I always remember him because he conducted my examination for 1.5 hours. He asked my questions. So that's why I always admire him. And I'm lucky that we have conducted many 3-4 examinations with him. So he inspired not only me, but many of us to become a good teacher and examiner for better human being. And my dear friends, I always say, in whatever profession you are, or you may be, your principles are always your greatest ability. Funda यह है कि आप चाहे किसी पेशे में हो, this is the management funda of the and Raghu Raman is a management guru. He says कि किसी भी पेशे में उसूल ही आपकी सबसे बड़ी काबिलियत है. अगर आपके principles हैं आपकी life में, you got principle in your life, everybody likes you. If you don't have principle in your life, nobody likes you, whatever capability you may be having. And before I end, I tell you, please read this book about the 7 habits of the highly effective people of Stephen Covey. He says there are 7 good habits. One is very proactive. Whatever condition may be there, always think of good. You may say there are so many problems are there. Dentists are not getting jobs. So many things are coming. This is bad, and anybody is bad. Exam is tough. But what you too can do in that condition best, that you must do it. That is for the proactive people. Reactive people always curse. Proactive people do the best in the worst circumstances. Begin in the end mind that what you want to be remembered. If I want to be a good teacher, I have to behave like a good teacher. If I want to be remembered as a good examiner, I have to behave like a good examiner. So that begin with the end in mind. If I have to become good husband, I have to behave like a good husband. I want to remember like a good father, I have to behave like a good father. Put first thing in the mind. We all want happiness in the life. What we should do. So be happy. If you want, what do you want? We want happiness. We want good health. So we must work for that thing. We must do some exercises. We must do some yoga, pranayam, so that we can become happy. Be good to others so that happiness comes to you. Always think win-win. Seek the first to understand, to be understood, then to be first to understand, then to be understood. Synergize. That take others' help also if you want to achieve goal. And then last is always sharpen your skills, like what Mahalakshmi Madam is doing. That always attend this faculty development programs, the conferences, the good conferences. Attend them so that you are able to sharpen your skill and you always have a chance to improve yourself. With these words, I thank you again. I thank Dr. Mahalakshmi Madam. I thank Dr. Karna sir for chairing session and this your SRM Dental College for organizing this wonderful event. Thank you very much.
Oh, thank you very much, Dr. Tewari sir, for that wonderful lecture. And more than 3 decades of experience is put in a nutshell. And actually, every slide what he has put has extraordinary content in that. Why I say this? Because sir, he himself from the internship days, he is a gold medalist. So what he talks, he means it. He has contributed to our profession so much. And also the teachers, maybe most of the teachers who are watching this program, 2 or 3 points which he put in a gist, that a student has undergone 3 years of program, giving an exam for 2 days. We should see his mindset. And if we are in the student shoes where we are put up, and what is going to be the performance. And if you see all the 9 specialties of our masters, only specialty which has so much of laborious clinical exercises is conservative dentistry and endodontics. Starting from case selection, whether it is a post-core or inlay or a root canal, it's not only selection of the case, we perform the treatment in all the 3 cases. Yes, it's not so in any other department, where some departments have only treatment planning, some departments have a single case treatment, some departments have only presentation of the case. But our students are having so much of laborious working. So their mindset at the end of the day, when they come for Viva Voce, actually, if you ask me, they are not in the state of giving an exam. If they are seriously worked for the 3 days, you understand, when I have given my master's exam in the evening or the late evenings, we go to the laboratory, do the casting procedure and go back for the work. So really, sir, what you said is having a lot of content, that the student should be given adequate time. And he has done 3 years of program with 5 or 6 questions. If we just send the student away from the Viva, seriously, he will go back and look at master's exam, what I have given, I am not justified. But who has to answer? Ultimately, we the teachers are responsible. Yes, you have opened the eyes of all the teachers who are teaching. We should give adequate time. And also, again, I end up this comment with the quote of Sarvepalli Radhakrishna, a great teacher, who said, "When we think we know everything, we cease to learn." Dear faculty, including myself, all of us should understand that every day we are learning, and the student as well is learning. We should have that maturity in conducting the exam. Again, entire syllabus should be covered when a student is giving Viva, where he goes back happily, whether he answers or not. And I once again thank sincerely the effort put by Dr. Mahalakshmi Madam, Dr. Rajkumar, and Dr. Madana and team. If I have missed out anybody, my sincere apologies. Thank you very much for giving me the opportunity.
Thank you so much, sir. Thank you, Dr. Sanjay Tewari, sir, for that. Whatever, actually I wanted you to tell or inform, you have actually delivered it. And the reason for giving Dr. Sanjay Tewari this particular topic was because of my personal experience with him when he had come as an examiner to our college.
Yes.
We have 8 students, but even at the end of the second day, he made sure that all the 8 students were given equal time for the Viva. Never, even, the other examiners were all, ready to go home, but he would not budge. He said, we have to give equal importance and give them the time, because as he said, we are assessing 3 years in 2 days, which is definitely not enough. But the way he conducted it, asking questions, relevant questions, actually, he even had a small paper in his hand, written down, like sequentially he was asking questions. So which was very, very, I was inspired by that. And we try to be objective, but we actually may not be. So this is one topic which I wanted him to, in fact, he was very skeptical also, ki, main kaise karunga or all that. But really, because you're the apt person to tell this to our people, that we need to be more objective in our assessment. They said that by the time the first two students are asked maximum questions, because their roll number comes 1 and 2, because for people they'll get the most. So that way you've really done us very good, Dr. Sanjay Tewari. Thank you so much for that presentation, and to Dr. Karunakar for always accepting at the last minute also. Anytime we call him, he's there. And thank you so much, Dr. Karunakar. It was an honor having you with us.
It is, after all, Dr. Mahalakshmi Madam, we are always there for you because you work for the noble cause. And I always remember when I was just becoming first time as an MDS examiner, I had the fear. I usually talk to my close friends, just I'm ending with a lighter note. I was asking Dr. Danya Kumar sir once, sir, I'm going first time for the examiner for the PG. What should I ask? And can you give me some outline? He's just put in a nutshell one word, maybe you take it lighter win. See, Karnakar, when you go to undergraduate, you will ask generally routine questions like steps in cavity preparation. When you go to PG, you ask recent steps in cavity preparation. That becomes a master's question. So that's how we all have to update ourselves. The recent things matter a lot.
Thank you, madam. Thank you very much, madam.
Thank you really, sir. In spite of both of your busy schedule, I know you both are really very busy, but thank you so much for honoring this podium. And for this, we come to the end of the 4th day session, and we have had wonderful feedback from all the participants. And I really thank the participants for being there all the time. They're there till the end. So it was really nice to see that nobody goes off just like that. So maybe we come back again on Monday. So see you all. Thank you so much once again.
Thank you very much.
Thank you, sir. Thank you.
Thank you. Bye-bye.
Yeah.